When do the tests or the scans just stop yielding results?
Um, that's tricky because sometimes you won't see a lot of change on the scans, but you'll see maybe some change, like maybe the lab numbers, for your heart disease, or the lab numbers for your cancer, labs, or the scans for your tumor growth, or the burden of your the occlusions of the vessels in your brain, right? You can see all these things change over time. And some of what the results show might not show a lot of difference in value. That might not show a large difference in impression where, okay, this tumor was 2 centimeters and now it's only 2.2. And that doesn't seem maybe super significant. So sometimes there comes a point where we have to kind of consider those things and then also focus on ourselves as the patient and what we're personally experiencing and feeling. When I was a bedside nurse, they would talk about if your monitor starts alarming, the first thing you do is check the patient, right? Because maybe they don't have no pulse, maybe they do have a heart rate and they're talking to you just fine, but the monitor says they don't have a heartbeat and they just got disconnected. So if we treated every lab and every single image the way that it looks, straightforward, if I treated every monitor without looking at the patient first and asking the patient first, like, how do you feel? What is your experience? Those other results are important for us to take into consideration, but there does come a point where they're secondary to really what the real lived experience is for the person suffering the serious illness.